Asing, I'm a nurse practitioner student. I'm going to examine my patient Haifa for cardiac, respiratory, and abdominal system. Hi Haifa, how are you?
Good.
How are you feeling today?
Fine.
How's your day going on so far?
Nice.
Okay, I'm going to examine your heart, lungs, and your abdominal system. Okay, can we start?
Sure.
Okay. Let's start with the respiratory system. First, we examine the chest on the front and the back, both sides. The chest looks normal bilaterally, and we start from the back. We start with the palpation. We palpate whole of the chest and the thoracic cage, starting going down, examining the spine, that it's normal, it's in the center line, and the vertebrae are equally spaced. Then we go on the side also. When I place my hand, just say 99, okay?
99, 99, 99, 99, 99, 99.
Resonance looks normal. Then we percuss the chest, starting from the first intercostal space down. Similarly on this side, should be high resonance because it's the air is unfilled. Now we auscultate. Before that, we could also check for the expansion during the breathing. It's on the T10. We place our hands right next to the spine. Haifa, can you breathe in and out for me? Check for the hand movement. It should be equal bilaterally across the spine. Then we auscultate for the lung fields. Can you breathe in and out? For one cycle, we have to auscultate on each and every point. On the anterior side of the chest, we inspect the chest on the anterior side. There's not much to do in the thoracic cage on the anterior side, though we can still see the resonance, and we could palpate a little because of the muscular mass in the breast tissue. We cannot palpate really well. So just see the lateral sides. Okay, can you say 99 again, please?
99, 99, 99.
I'm sorry, I know you're ticklish. Okay. Starting with now that concludes our thoracic and respiratory system. We should start with the cardiac system now. We check for the carotid pulse in the cardiac system first, one at a time. We could also look for the jugular vein distension, but that patient has to lie on the 30-degree angle. Allows the patient to rotate the neck on either side, and we measure and we see if the jugular vein is distended or not. We're going to listen to the cardiac sounds now, starting from the right sternal border, right at the first second, intercostal space with the diaphragm. There's the aortic, pulmonic, Herb's point, right here. It's the tricuspid and the mitral. We do similar for the bell. Heart can you examine in multiple positions. You could examine by when the patient is side lying, sitting, even when lying on supine. And now we should examine for the abdominal sounds. Abdominal sounds. S1 is S2 is heard over the whole this area, and over the aortic and pulmonic area it goes beams down, and then it starts with the S1, which is heard mostly with the tricuspid and mitral area. If any abnormality, we could hear here with the bell, the stethoscope. It has to be lightly palpated with the bell. I can't hear any abnormalities. That concludes our cardiac system. Now we're going to start with the abdominal system. Can you lay down hard please? First, we inspect abdomen for all for symmetry and distribution. There should be no masses visible, anything. The cut surgery for the previous cuts with the surgery and any suture line. And then we start with the auscultation of the abdomen first, because any other activity can mess up with the bowel sounds. We percuss in all four quadrants, starting from the right lower quadrant. Similarly, with the bell of stethoscope, we see the aortic sound, which is right next to the umbilicus on the left hand side, and then we listen to the renal on the either side, the iliacs, then the femorals. Look normal. We could also check for the aortic resonance, which is right next to the umbilicus, and we could check with the first finger and the thumb, and it should not be more than 2 centimeters. Now we're going to start with the percussion of the abdomen from the 5th, 6th intercostal space for the liver. Here's the liver. It sounds dull. Should percuss the whole abdomen, bladder, and the stomachs, and the spleen. It looks normal. Let's mark the region for the liver starting from the 5th, 6th intercostal space going down. Should sound dull as soon as you strike the liver. Here it is. And then from the level of umbilicus, the mid-clavicular line, go up. Mark the lower region of the liver, and we could measure it. Mark here with the pen, we could measure it. Should not be more than 6 to 5, 6 centimeters. And then we could also percuss the spleen on the mid-axillary line, or we could ask the patient to rotate on the right side a little bit, please. That's it. Little bit. That's fine. Thanks. Could you place your hand like this? Thanks. On the mid-axillary line, here's the spleen on the 10th, right, on the 10th, 11th side, and then on the anterior axillary line, similar. Thanks. Can you go back to the position, please? That's okay. Now we're going to start with the palpation of the abdomen. Starting from the right lower quadrant, we're going to go with the light palpation, clockwise, palpating each and every quadrant, watching for any masses, any abnormalities. Looks normal. We'll start the deep palpation. Press. Palpate 5 to 6 centimeters, 5 to 8 centimeters deeply. Okay. Now start with the palpation of the liver. I'm going to slide my left hand underneath the patient on the 5th, 6th intercostal space and palpate for the liver. Could also stabilize the liver. Yeah, palpate it. Yeah. Similarly, the spleen, right on the costovertebral margin, 11th, 12th rib. Yeah. Spleen can be palpated normally. If it's palpable, that's abnormal. We could also palpate the kidneys. Slide right on the lower back, and then ask the patient to inhale and then exhale. Then you could palpate the kidney. That concludes our abdominal assessment. Thanks.